Welcome to UMCC Medical Consultant Connectors, where your health matters to us. We're all about bridging the gap between medical knowledge and everyday health challenges. Our mission? To arm you with practical, medically informed advice that can make a world of difference in your daily life. From tackling toddler tantrums to managing migraines, we're here to help you navigate the health hurdles life throws your way. Remember to like, subscribe, and share our videos for more health-related insights. To address the issue of tantrums, we first need to understand why toddlers throw tantrums. Now, imagine a tiny human, new to the world, and still figuring out how to navigate it. They are filled with curiosity, excitement, and a whole lot of energy. But they also have limited language skills and are just starting to learn how to manage their emotions. This is the typical life of a toddler. The brain of a toddler is like a sponge, soaking up information from the world around them. But it's also under construction. Key areas responsible for emotional regulation, such as the prefrontal cortex, are still developing. This means that toddlers don't always have the mental tools to handle frustration, disappointment, or overwhelming feelings. Hence, they express these intense emotions the only way they know how, through tantrums. Tantrums are also a form of communication. Toddlers are at a stage where their wants and needs often outpace their ability to express them verbally. So, they use tantrums to convey their frustration and to assert their independence. It's their way of saying, I'm upset and I don't know how to deal with it. But it's not just about brain development and communication. The environment also plays a critical role. Toddlers are keen observers. They learn how to react to situations by watching the people around them. If they see others responding to stress or disappointment with anger or frustration, they are likely to mimic those behaviors. Moreover, a child's environment can also trigger tantrums. For instance, a change in routine, hunger, tiredness, or overstimulation can all lead to tantrums. It's important to remember that toddlers have a low threshold for stress, and even minor changes can be overwhelming for them. So, when we talk about tantrums, we're not just talking about bad behavior. We're talking about a complex interplay of brain development, emotional regulation, communication, and environmental factors. Understanding the reasons behind tantrums is the first step towards effectively managing them. By understanding why toddlers throw tantrums, we can begin to develop strategies that not only help manage these outbursts, but also support our toddlers' emotional growth and development. Now that we understand why tantrums occur, we can discuss some strategies for dealing with them. Firstly, it's crucial to validate a child's feelings. While a toddler's tantrum over a broken crayon might seem trivial to us, to them, it's a big deal. Instead of dismissing their emotions, acknowledge them. Say something like, I see you're upset because your crayon broke. That can be frustrating. This validation helps them feel understood and can often diffuse the situation. Next, setting clear boundaries is key. Toddlers need to understand that while it's okay to feel upset, it's not acceptable to express those feelings through destructive behavior. It's essential to express this in a way they can understand. For instance, you might say, I understand you're angry, but we don't hit when we're upset. Modeling calm behavior is another effective strategy. When your toddler is in the midst of a tantrum, they're looking to you to understand how to manage their emotions. If you respond with anger or frustration, you're teaching them that these are appropriate responses to stress. Instead, maintain a calm demeanor and demonstrate how to express feelings in a more controlled manner. Remember, patience is your best friend during these tantrum episodes. Toddlers are learning how to navigate the world, and they'll inevitably experience emotions they don't know how to handle. It's up to us to guide them through these feelings with understanding and patience. Consistency is just as vital. If you give into a tantrum one day, but not the next, your child will be confused about what's acceptable and what's not. Be consistent in your responses to help them understand. While tantrums can be challenging, using these strategies can help you navigate this phase of your child's development. It's not always easy, but remember, you're not alone. We've all been there, and these tantrums are just a small part of your child's journey towards becoming a well-adjusted individual. To wrap up, we've discussed why toddlers throw tantrums and how to handle them. We've learned that tantrums are a normal part of a child's development, often triggered by frustration or a need for attention. We've also delved into strategies to manage these outbursts, such as remaining calm, using distraction tactics, and reinforcing good behavior. Remember, your child's tantrums are not a reflection of your parenting. Stay patient, stay consistent, and know that this phase will pass. Thank you for watching UMCC Medical Consultant Connectors, where your health matters to us.